Okay, so my name is Miranda, and I am going to be presenting the financial business plan for Metropolis Health System that will include the discussion of implementing three different service lines in the immediate future for the organization. So the first couple of slides, we will discuss the current services that the organization offers. So MHS has focused its attention on overall reducing hospitalizations and increasing its outpatient and same-day surgery visits instead. So there's much more attention placed on prevention rather than treatment, and those services include a rehabilitation and wellness center, which includes outpatient physical therapy, cardiac and pulmonary rehabilitation, and return to work services, as well as some long-term care services, which include home health and a skilled nursing facility, which is an inpatient nursing facility that assists patients in returning more fully to an independent lifestyle. So this next slide just continues the current services that the organization offers. So of course it offers same-day surgery, which eliminates the need for an overnight stay. There are community health and wellness initiatives, which are outreach programs that provide educational seminars on a variety of health issues. This includes a diabetes education center, health awareness events, a women's health resource center, and cancer support services. The organization also offers occupational health services, which help to reduce workplace injury costs by collaborating with over 100 area businesses through consultation on injury avoidance and work-specific rehabilitation services. And finally, it offers recovery services, which include mental health services, including substance abuse programs and support groups, as well as individual and family counseling. So with these efforts and initiatives to focus on prevention, inpatient visits have increased by only 1,000 per year since 2010, whereas outpatient and same-day surgery visits have had an increase of over 50,000 per year. The services and facility enhancements offered by MHS support this transition to provide the quality, convenience, affordability, and personal care that best suits the needs of people MHS serves. So here we'll move on to discussing the new areas of service. So MHS has identified 5 areas of desired service and programmatic enhancement in its 5-year strategic plan. And those include ambulatory services, physical medicine and rehabilitative services, cardiovascular services, oncology services, and community health services. So these have been identified to address the most critical health needs specific to the community. And this next slide, we will discuss prioritizing the new services. So although all 5 areas that have been identified are important to the community, the following 3 have been identified to be prioritized and implemented first, to include cardiovascular, oncology, and ambulatory services. So the reasoning behind this is these are more likely to provide the care necessary for the community while also putting MHS in a financially feasible position. The reimbursement rates will be highest for these services areas and will allow the organization more operating income to support the implementation of additional physical medicine, rehabilitative, and community health services as part of the 5-year strategic plan. So MHS already has a presence in rehabilitative and community health services. So these can be expanded a little bit later on in the planning process. Additionally, the new ambulatory center built 2 years ago will mean the organization will already have some physical space accounted for when considering offering additional outpatient services, which the organization is highly focused on with its current initiatives. So here we have a very busy slide that discusses one of the main financial statements of the organization. So it is the balance sheet. So over here on the left side discusses all of the assets of the organization, and over here on the right side of the slide we see a layout of all the liabilities of the organization. So we can see that the total current liabilities in this area, in this row right here, have decreased by $475,000 over the last year, while the total current assets over in this row over here have increased by $650,000. And the total current assets over here are $4.8 million greater than the current liabilities for the current year over here. This puts the organization in a great liquidity position to meet short-term financial obligations and its expansion efforts. So moving on to another important financial statement for MHS, here we can discuss the income statement, which is a simplified trend analysis for the overall profit of MHS. So we can see here in this row the total operating revenue, and that has increased over the last year. The total expenses has decreased over the last year, and the overall income from operations has increased by $860,000. And the total organizational revenue and gains in excess of expenses and losses down here has increased by $850,000 from the comparing years to this year over here. And finally, moving on to the cash flow statement, we can see our aggregate data regarding all cash flows from our operations, investing, and financing activities. So the first section up top here includes transactions from all operational business activities. The second section right over here is cash flows from investment and is the result of investment gains and losses. And the final section right down here, we can see an overview of cash used from debt and equity. So after evaluating all of the sections, adding income and subtracting our expenses, we come to a net available cash amount of $1.15 million available to the organization down here. So now that we've discussed the financial details of the organization and where we are currently sitting, I want to take a little bit of time to discuss some of the challenges that we might encounter moving forward in implementing these new service lines for the organization. So we'll start with staffing here. It is anticipated that with the addition of the oncology and cardiology services, the organization will begin with adding one cardiologist and one oncologist right up here, as well as a supporting mid-level for each specialty physician. So that could be a physician assistant or a nurse practitioner. In addition, I didn't put the number here, but we will expect to onboard 5 nurses to offset the influx of patients who will need care coordination. So the primary concern here with adding this many providers is the staffing shortage and that trend that's occurring with healthcare currently. So a little more detail behind that. The Association of American Medical Colleges projects a shortfall of specialty care physician ranging from 33,700 and 86,700 providers by the year 2032. And the American Association of Colleges of Nursing anticipates the RN workforce to grow from 3 million in 2019 to 3.3 million in 2029, which is an increase of 221,900 nurses, or an overall 7% influx in that field. So we're going to need to do some efforts to recruit and retain these providers and meet the service demands that we are trying to grow here. So we'll So what we'll have to start with is forming strategic partnerships with collegiate institutions and consider tuition reimbursement in exchange for a contractual agreement. And we'll also need to focus on creating and supporting a culture that is inviting and consider incentives such as relocation allowances and sign-on bonuses for all of these providers, especially the physicians, more than anything. But if we run into a bind with nursing, that might have to be something to be considered as well. The next challenge I have identified is physical space. So we will need to consider where additional cardiology and oncology services will be provided, because we are assuming that the ambulatory services will be able to be in the new addition that the organization had implemented a couple of years ago. So the possibilities are basically to either infiltrate existing areas of the hospital and to reconstruct there, or to potentially construct a new area for these services utilizing the land the organization has available to it as part of its assets. So another thing that we'll have to consider is that there is already construction currently in progress for the organization and how these new services will fit into the current plans. So each construction opportunity will lend itself to its own challenges. However, we just need to make the best decision that will make most sense for current and future growth of MHS and how patients will be best served. So this here is just a chart that provides a rough idea of the predictions for anticipated expenses and revenue for adding the new service lines to the organization. So over here, I kind of calculated rough estimates for provider salaries, nurse salaries, supplies and equipment, and construction costs. And over here, I just did a quick estimation of the cardiology revenue, oncology revenue, and ambulatory revenue that the organization will bring in. So we can see that the total expenses over here, total revenue, anticipated revenue over here. And after this first year, once we lose the construction cost, we can see that the revenue will significantly outweigh the cost of running these services in the long term. But in the immediate future, we can utilize ongoing cash flows from operation, patient revenues, and the corporate depreciation fund to finance the service expansion. So in conclusion, the immediate expansion of cardiology, oncology, and ambulatory services will provide the community with necessary additions to improve access to care and meet health demands. Additionally, having as many on-site services provided as possible will improve efficiency across the continuum of care and prevent care delays for patients. So that's from a clinical perspective. And from a financial perspective, these new services will provide the organization with new and ongoing income from a consistent patient revenue source that will result in long-term financial security.